Hi, Mrs. S. This is going to be your psychological assessment report. We'll go through this together, and it's just going to do an overview of the assessment that you've just completed with some specialized notes or points of interest, and then the impression of the exam. Before, as we begin, we do the interviews and observations and the different assessments that we did. So we were able to decide on some of your current symptoms or the major ones that we can see causing the biggest factor. And they're in no particular order, but the top 5 were anxiety, depression, attention/concentration, stress, which we can link to PTSD from your Army stint with your Army, and then the memory functioning. These, the memory and stress, have multiple triggers in your life, but it looks like the Army was the greatest influence on your dealing with your stress and the memory and recalling things, also with your anxiety and your depression. For your history, we discussed your history and your upbringing, and there are certain factors that stood out. Surgery is very tough on the body, and you mentioned you had your a dust cyst removed, but the procedure required multiple exams. That is a red flag for your body. You also do have a physical limitation with your activity-induced asthma. You are on menstruation medication, and those have side effects that do come along with it, with your anxiety and your depression. It is an emotional, psychological type of, it's a physical drug that affects your body, and anything that affects your body can have devastating effects on it, just not physically. Emotionally, psychologically, those areas are sometimes affected by these medications as well. Also, you did have a weight gain after the discharge from the Army, which could have been the depression or any of those factors. We still can maybe contribute that to the medication that you're on as well. But as you did have some negative, we did have a lot of positive as well. Your progress and your adherence with your antidepressants were admirable. You have a clean record of no alcohol, tobacco, or drugs, which makes the recommended finding a treatment plan for you that much easier. You maintain your personal health with exercising despite your asthma limitation, and that can be seen both ways. You do have a network of support between your marriage and other people, and it is always easier to battle these things when you do have a level of support with you. So for your observations, we gave you some exams, and the top 5 were fields of it was cognition, achievement, information processing, memory, and executive functioning. Under the cognitive section, there were some concerns, but I'm willing to bet that the complications were just a result of your anxiety when it comes to tests and exams. The achievement portion, similar to the cognitive assessment, but we noticed that when extra time was given to you, you performed very well. You definitely, there was a difference between your before time and then after extra time was noticed. Your information processing assessment opened light to a slight ideation that you may have a mild case of attention deficit hyperactivity disorder or ADHD. Your memory and executive functionings were actually pretty much in the expected range. You had the memory portion of your exam was when additional time was given to you, you did another exceptional job. So we've noticed that time is kind of one of the factors for you. During your observations, your interviews, we were able to examine your personality a little bit. You displayed a level of tension, depression, and agitation over certain aspects of your life. And this can be expected with your background, given your history and your background with the Army and everything else with the procedures that can be expected. But it brings into question the satisfaction of your current social structure. You have a large network support network, but socially we couldn't specialize, or it didn't specialize on how happy you were with your social structure and your social life. Your anxiety was very high, which may require medication, but we're going to, work on creating some therapeutic methods for you to use in lieu of medication or in addition to the medication. However, it did show that your antidepressant was working for you, because the depression symptoms that you exhibited were observable, but not to the level where they can be diagnosed for depression. So that's a good thing. The results of your exam is we recommend that you, or I recommend that you that you have double time for examinations, because that seems to be a factor for you to where you can do much better when you're allowed more time. Assistance on standardized testing, because you notice math is a weakness of yours, and we saw it through the cognitive and the achievement portions of your assessment. So we can do that. That is a recommendation. Because of your anxiety, we recommend that you do extra rest breaks during testing to break up the monotony and the tediousness, and to give your mind a break, because that seems to work for you as well. Also, when you do your assessments, we do recommend you doing it in the environment that has the least amount of distractions for you. Although the ADHD was at a lower rate, it could become a problem in the future, and it could develop and mature a little bit faster. Of course, we do recommend a follow-up session, maybe within a week or two, just to see how everything's going. We can test out some therapy, see how the therapeutic methods are working for you, your medications, and an update. And lastly, we do the stress relief therapy, which is something that you kind of do on your own. It's just what works for you. I noticed that you have the hobbies of being active. You take your hikes and your walks, which are good ideas and good strategies to use. We have some, as far as like multitasking, trying to keep that to a minimum. You can kind of lower your stress load. Taking one project at a time, finishing it, and then going to the next one. Maybe writing down information in a personal journal would also be something that helps. It helps your memory and recalling events. And that would be our recommendations for you. It seems like you do have some depression, a level of depression, but you are on medication for that. And we have your anxiety that we are working on, so that we can get it to a level that we both are satisfied with. Other than that, this is your assessment, and we will meet again for your follow-up. Thank you.